Screening, assessment, and diagnosis of substance use disorders are critical to creating appropriate case plans. But sometimes there's confusion about the meaning of these terms. Let's look at each of them. Screening is a brief process that determines if further evaluation is necessary. Screens ask broad questions, and they require little or no training to administer. The outcome of a screen is generally yes or no. Yes, further evaluation is necessary, or no, it's not. If there's a positive screen, a client is generally referred for assessment. An assessment is an in-depth evaluation. It determines the nature and extent of the problem. Assessment usually results in a diagnosis and treatment recommendation. It's possible, though, for someone to screen positive and then, through the assessment process, be determined not to need treatment. A diagnosis is made by a mental health professional or addiction specialist. They use the Diagnostic and Statistical Manual of Mental Disorders, Volume 5, known as the DSM-5. The DSM-5 combines abuse and dependence into a category called substance use disorders. Substance use disorders have different levels of severity. The DSM-5 establishes 9 types of substance-related disorders: alcohol, caffeine, cannabis or marijuana, hallucinogens, inhalants, sedatives, hypnotics, or anxiolytics such as Valium and Quaaludes, stimulants such as cocaine and methamphetamine, tobacco, and opioids such as heroin, which have their own set of diagnostic criteria. Diagnosis is based on a pathological set of behaviors related to the use of that substance. There are 4 main categories. A person with impaired control has cravings that are so intense it's difficult to think of anything else. They may use for longer periods of time than intended, use larger amounts than intended, want to reduce use but can't, and spend excessive time getting, using, and recovering from use. Social impairment means a person continues to use despite issues with work, school, family, and social obligations. They may give up social and recreational activities because of their substance use. Risky use means repeatedly using substances in physically dangerous situations, like driving a car or operating machinery. It also means continuing to use despite knowing that it's causing physical and psychological problems. Pharmacological indicators, such as tolerance and withdrawal, are adjustments made by the body to adapt to continued use. Tolerance occurs when an increased amount of a substance is needed to acquire the same effect. Withdrawal is the body's response to abrupt cessation of a drug once the body has developed a tolerance to it. After a mental health professional diagnoses a substance use disorder, they determine the level of care or treatment that client will need. Select Next to continue your learning by exploring treatment options.